You know the feeling when something just feels off? A voice that's a little rougher, a small cut that won't heal, or a persistent cough you just can't shake. Most of us dismiss these as minor annoyances. But what if I told you that these seemingly harmless signs are actually your body's way of whispering a terrifying truth? A truth that could signal the beginning of a life-altering disease. Doctors say that many of the most dangerous conditions, from heart disease to diabetes and even liver failure, don't strike without a warning. The body sends out secret signals, like a hoarse voice or phony urine, that are often ignored. We've uncovered the science behind these red flags and the real-life cases that prove how a small symptom can be the first step on a path to a catastrophic diagnosis. In this video, we're revealing the 7 secret signs you need to know and what they say about your health. You won't believe what made it to number 1. Let's begin with number 7. Slow healing wounds. When a small cut or blister refuses to heal, it may seem like a minor inconvenience, but in reality, it can be one of the most alarming signs of an underlying chronic disease, type 2 diabetes. In this condition, persistently high blood sugar disrupts the body's natural ability to repair tissue. The breakdown is multi-layered, affecting blood vessels, nerves, and the immune system all at once. High glucose levels cause the blood vessels to stiffen and narrow, a process known as atherosclerosis. This restricts blood flow to the extremities, meaning essential oxygen and nutrients can't reach a wound site. At the same time, diabetes damages the nerves in the feet and hands, a complication called peripheral neuropathy. Many patients lose sensation in their feet entirely, which means they may not even notice a blister, cut, or sore until it has become infected. To make matters worse, excess sugar in the blood weakens the immune system, slowing down white blood cells that normally fight infection. Meanwhile, bacteria thrive in the glucose-rich environment, turning even a small wound into a dangerous infection. This triple system failure explains why diabetic wounds, especially on the feet, can progress into what is known as a diabetic foot ulcer, DFU. These ulcers are not just difficult to treat, they are deadly. Research published in the Health Innovation Program reports that between 19 and 34% of people with diabetes worldwide will develop a foot ulcer in their lifetime. The outcomes are stark. Within 5 years of the first ulcer, over half of patients die, and around 5% require limb amputation. Real-world cases make the statistics even more sobering. In one report, an 88-year-old man with type 2 diabetes developed a non-healing wound that doctors initially treated as a typical ulcer. A biopsy later revealed it was actually melanoma, which had already spread to his lungs. In another case, a man with uncontrolled diabetes lost a toe due to a wound that would not close. Tragically, new ulcers kept forming, and he eventually needed a below-knee amputation. These examples highlight why a wound that lingers is never just a wound for a diabetic patient. It's often the first visible sign of systemic collapse. The good news is that this sign doesn't have to become a death sentence if caught early. Doctors strongly advise daily foot inspections for anyone with diabetes. Even something as simple as a mirror to check the soles of the feet or asking a family member to help can be life-saving. If a blister, cut, or fungal infection is spotted, seeking medical care immediately is critical. A slow-healing wound is not merely a cosmetic issue. It's the body's desperate cry for help. Listening to that warning and acting on it can prevent amputations and even save lives. 6. Nosebleeds. A nosebleed is one of those symptoms we often shrug off. Maybe the weather was too dry or we rubbed our nose too hard. But when nosebleeds become frequent or severe, especially in someone living with high blood pressure, the body may be signaling something far more dangerous. The relationship between hypertension and nosebleeds is complex and sometimes misunderstood. Doctors emphasize that everyday, mild nosebleeds are usually caused by local factors, like dry air or nasal irritation. However, in cases of uncontrolled hypertension, the fragile blood vessels in the nose become more prone to rupture, and when they do, bleeding is often heavier, harder to stop, and more likely to recur. This is not the innocent trickle most of us are familiar with. It can be a red flag of vascular fragility under pressure. Medical literature makes an important distinction here. Not every nosebleed means high blood pressure, but in the context of severe hypertension, what doctors call a hypertensive crisis, the connection is real and clinically significant. A hypertensive crisis is defined as blood pressure spiking to 180 over 120 millimeters Hg or higher, a medical emergency that can damage the brain, heart, and kidneys. Studies show that about 17% of patients in hypertensive crisis present with nosebleeds, often alongside symptoms like severe headache, dizziness, chest pain, or vision changes. The danger is not the blood itself, it's the message behind it. Blood vessels are under so much stress that they can no longer hold. If ignored, the same pressure that bursts delicate nasal vessels could just as easily rupture vessels in the brain, leading to a stroke. Real patient cases illustrate this vividly. One emergency department report described a man who arrived with a nosebleed that had been running for over 20 minutes. His blood pressure was measured at 210 over 115 millimeters Hg. The nosebleed wasn't random. It was his body's desperate attempt to warn of a hypertensive emergency. He required immediate blood pressure management and hospital observation. Cases like this remind us that while hypertension is often called the silent killer because it hides without obvious symptoms, sometimes the nose gives away the secret before it's too late. Here's a takeaway you can use right away. If you or someone you know experiences a nosebleed that is difficult to stop, especially alongside dizziness or chest pain, check blood pressure immediately and seek urgent care. A simple home blood pressure monitor can be a life-saving tool. Remember, it's not the minor, once-in-a-while nosebleed that should scare you. It's the frequent, severe, or stubborn ones, particularly in someone with high blood pressure. When the body bleeds like this, it's not whispering, it's screaming for help. 5. Swelling in legs or ankles, edema. It often begins quietly. Your shoes feel tighter by the evening, or your socks leave deep marks on your ankles. Many people dismiss this as harmless water retention, but doctors know better. Swelling in the legs or ankles, medically called edema, can be one of the earliest outward signs of heart disease. When the heart struggles to pump blood effectively, fluid starts to back up in the veins. Gravity pulls that excess fluid down into the lower legs and ankles, creating the visible puffiness. Press a finger into the skin, and it may leave a pit that lingers, a classic marker of what physicians call pitting edema. This is not just cosmetic swelling, it is the body's way of revealing that the cardiovascular system is under strain. The science behind it is both fascinating and alarming. In heart failure, the weakened heart cannot keep up with the body's circulatory demands. This increases venous pressure, especially in the lower body where gravity makes blood return more difficult. To compensate, the body activates the renin-angiotensin-aldosterone system, RAAS, a hormonal loop that signals the kidneys to hold on to more sodium and water. At first, this helps maintain blood pressure, but over time, it creates an even greater buildup of fluid, worsening the edema. Research published in Biomedicines notes that myocardial edema itself, swelling inside the heart muscle, can reduce cardiac output by 15% or more, further weakening the heart's ability to circulate blood. It's a vicious cycle. The weaker the pump, the more fluid builds up, and the more fluid builds up, the weaker the pump becomes. Doctors often see this play out in real patients. One case involved a 54-year-old woman with diabetes and hypertension who noticed her legs were swelling so much that daily activities became exhausting. Her physical exam revealed 2+ pitting edema and shortness of breath. An echocardiogram confirmed a severely reduced ejection fraction, the classic signature of systolic heart failure. Her swollen ankles weren't just a cosmetic problem, they were the first sign that her heart was struggling to sustain her life. A simple tip can make all the difference. If you notice swelling in your legs or ankles that doesn't go away after rest, or if it worsens by evening, don't brush it off. Measure your weight daily. Sudden weight gain of just 2 to 3 pounds in a day can be a sign of fluid buildup from heart disease. Swelling may look harmless on the outside, but inside it may be a signal that your heart is failing under pressure. In medicine, we call it edema. In reality, it's the heart quietly asking for help before it can no longer keep up. Foamy or bubbly urine. Most people don't give their urine a second thought. But if it consistently looks foamy, almost like soap bubbles that refuse to disappear, doctors see it as more than a bathroom oddity. It may be one of the earliest warnings of chronic kidney disease. At first glance, the foam may seem harmless, caused by the force of urination or dehydration. But when it lingers, it often signals proteinuria, the abnormal leakage of protein, especially albumin, into the urine. Healthy kidneys act like high-precision filters. They allow waste out but keep essential proteins in the bloodstream. When those filters, known as glomeruli, are damaged, often by diabetes or high blood pressure, they lose that selective barrier. The result is protein spilling into the urine, where it behaves like a detergent, trapping air and creating the telltale foam. What makes this sign tricky is that it isn't always reliable on its own. Studies reveal that only about 1/3 of patients who complain of foamy urine actually have abnormal proteinuria. The rest may simply be seeing temporary foam from factors like concentrated urine, speed of flow, or even recent exercise. But that uncertainty is exactly why doctors emphasize caution. The foam itself may not be proof, but it's an alarm worth investigating. The true confirmation comes from lab testing, particularly the urine albumin to creatinine ratio, UACR. A persistently high UACR over several months is a diagnostic marker of CKD, even when other kidney function measures like estimated GFR appear normal. Real cases show how easy it is to overlook this warning. One woman in her 30s ignored both her foamy urine and swollen ankles, assuming it was just stress. A routine test later revealed proteinuria, and a biopsy confirmed nephrotic syndrome, a serious kidney disorder. Another patient, diagnosed with focal segmental glomerulosclerosis during pregnancy, discovered her disease only because of protein spilling into her urine. With treatment, she was able to delay dialysis for years. These stories highlight how a bathroom detail most people laugh off can in fact be the first breadcrumb trail to uncovering a life-altering diagnosis. Here's a practical tip. Don't panic if you see foam once or twice. It could be benign. But if it's frequent, persistent, and especially if it comes with swelling in your legs or eyes, ask your doctor for a urine protein test. It's simple, inexpensive, and can reveal kidney damage long before symptoms like fatigue or nausea set in. In medicine, the foam isn't the enemy, it's the messenger, and paying attention to it could save your kidneys and your life. 3. Excess mucus production, phlegm. Imagine waking up every morning with a heavy chest and a throat full of mucus. You cough, clear your throat, and for a moment you feel relief, until it happens again the next day and the day after that. For millions of people worldwide, this isn't just an annoyance, it's the daily reality of chronic obstructive pulmonary disease, or COPD. Excess mucus is one of the earliest signs of this progressive lung condition, and it often appears years before patients realize how serious it really is. Inside the lungs, COPD quietly reshapes the airways. Long-term irritants, most often cigarette smoke, trigger inflammation. This inflammation causes goblet cell hyperplasia, an abnormal increase in mucus-producing cells, along with enlargement of the submucosal glands. The result is thick, sticky mucus that clogs the airways. At the same time, the cilia, tiny hair-like structures that normally sweep mucus out, become damaged and dysfunctional. It's like having the drains in your lungs clogged with glue, while the cleaning brushes have broken. Patients feel this as persistent phlegm, wheezing, and breathlessness. What makes COPD especially dangerous is its silent side. A large study found that up to 36% of patients had mucus plugs visible on CT scans, yet they reported no cough or phlegm at all. That means the disease can be progressing inside the lungs without the person realizing it. And those mucus plugs aren't harmless. They're linked to faster lung decline and a significantly higher risk of death. For a condition that's already the third leading cause of death worldwide, that statistic should not be ignored. Doctors often describe patient cases that bring this home. One man in his 60s, a lifelong smoker, came in with shortness of breath and a chronic smoker's cough. A CT scan revealed multiple mucus plugs obstructing his smaller airways, severely limiting oxygen flow. Another patient, a woman in her 50s, thought her morning cough was just allergies. In reality, she had early COPD that required immediate intervention to prevent long-term disability. These stories remind us that mucus isn't just a nuisance, it's often the body's alarm bell for a disease that can steal breath and life. Here's a tip doctors share with patients. If you're coughing up phlegm most days for 3 months a year, 2 years in a row, it's not just a smoker's cough. It's a diagnostic hallmark of chronic bronchitis, a major type of COPD. Early testing with spirometry can reveal the damage before it's too late. Excess mucus may look harmless, but in reality, it's a sticky clue that your lungs are struggling to breathe. 2. Spider-like blood vessels on the skin. At first glance, they look harmless, tiny red marks on the skin, shaped like a spider with legs stretching outward. Doctors call them spider angiomas. Press on the center and the redness fades, only to refill in seconds. Many people ignore them, thinking they're just cosmetic blemishes. But when multiple spider-like veins appear on the chest, face, or arms, they can be the skin's way of exposing a deeper problem, chronic liver disease. The mechanism is rooted in how the liver regulates hormones and blood vessels. In cirrhosis, when the liver becomes scarred and weakened, it struggles to break down estrogen properly. As estrogen levels rise in the bloodstream, blood vessels dilate abnormally, producing these distinctive spider webs on the skin. Research also shows that patients with cirrhosis often have high levels of vascular endothelial growth factor, VEG, a substance that stimulates the growth of new, fragile blood vessels. Together, these changes create a visible red network on the skin, a warning sign that the liver is under siege. Here's the striking part. A single spider angioma can occur in healthy people, especially in pregnancy. But multiple lesions carry a 95% specificity for chronic liver disease. In other words, when doctors see clusters of these tiny red spiders, they almost always point to liver damage. And the more numerous they are, the worse the disease tends to be. It's not just about appearance, it's about prognosis. Their presence often signals advanced disease and is associated with complications like hepatopulmonary syndrome and esophageal varices, both of which can be life-threatening. One real case illustrates the danger vividly. A 48-year-old woman with hepatitis C-related cirrhosis developed a massive spider angioma on her forehead, so large that it produced an audible hum of blood flow. It was not just a cosmetic concern, but part of a cascade of severe symptoms, jaundice, swelling, and fluid accumulation in her abdomen. Tragically, she died of an internal bleed just 48 hours after a medical procedure. Her case is an extreme reminder that what starts as a skin change can be the outward face of a failing liver. So here's a practical tip. If you notice new or multiple spider-like vessels on your skin, especially if you also experience fatigue, yellowing of the eyes, or abdominal swelling, don't dismiss them. Get your liver checked. These marks may be small, but they are powerful storytellers, revealing the silent struggle happening inside one of your body's most vital organs. Number 1. Hoarseness in voice. Your voice is more than sound. It's a reflection of your health. When it suddenly becomes raspy, weak, or deeper than usual, and no cold or sore throat is to blame, doctors start to think about the thyroid. In hypothyroidism, the thyroid gland doesn't produce enough hormones, and one of the earliest signs can be persistent hoarseness. The biology behind this is fascinating. Low thyroid hormone levels lead to the buildup of a jelly-like substance called myxedema within the vocal cords. This extra fluid thickens and stiffens the cords, altering how they vibrate and producing that rough, croaky sound. In advanced cases, swelling around the larynx and even pressure on the vagus nerve, one of the key nerves controlling voice, can make the problem worse. That's why some patients not only develop hoarseness, but also a narrower vocal range, vocal fatigue, and even difficulty projecting their voice. Clinical studies show that up to 98% of patients with hypothyroidism develop some form of voice-related symptom, a statistic that underscores how closely tied the thyroid is to vocal health. Doctors have documented striking cases. One patient, a 40-year-old man with unexplained weight gain and fatigue, came to the clinic with a muted, nasalized voice.
Using speech analysis software, his voice was measured as unusually slow, deep, and weak. Lab tests confirmed Hashimoto's thyroiditis, the most common cause of hypothyroidism. After 6 weeks on thyroid hormone replacement, his voice regained its strength, pitch, and clarity. The transformation wasn't just medical, it was audible. Stories like this remind us that something as personal as a voice can be a powerful biomarker of systemic disease. A quick tip here: don't ignore voice changes that last longer than a few weeks. While many cases are harmless, linked to infections or vocal strain, persistent hoarseness without a clear cause deserves medical attention. It might not be the throat that's failing you, but your thyroid. So the next time your voice doesn't sound like you, think of it as more than a quirk. It may be your body whispering that your thyroid is slowing down. And if you listen early, you can catch the problem before it grows silent and severe.
The video identifies 7 seemingly minor physical signs that can be early indicators of serious chronic diseases. The key takeaway is to listen to your body's subtle warnings to catch these conditions early before they become severe. Hoarseness and voice can be a sign of hypothyroidism because low thyroid hormone levels cause a jelly-like substance to build up in the vocal cords, making them rough and stiff. Spider-like blood vessels on the skin, spider angiomas, can indicate chronic liver disease as a damaged liver struggles to break down estrogen, causing blood vessels to dilate abnormally. Excess mucus production, phlegm, can be an early sign of COPD, chronic obstructive pulmonary disease, where inflammation leads to an increase in mucus-producing cells and damage to the cilia. Foamy or bubbly urine may signal chronic kidney disease, CKD. This is often due to proteinuria, the leakage of protein into the urine when the kidney's filters are damaged. Swelling in the legs or ankles, edema, is a common sign of heart disease. A weakened heart can't pump blood effectively, causing fluid to back up in the veins and pool in the lower body due to gravity. Frequent or severe nosebleeds can be a red flag for uncontrolled hypertension, high blood pressure. During a hypertensive crisis, the fragile blood vessels in the nose can rupture more easily. Slow-healing wounds are a hallmark symptom of type 2 diabetes. High blood sugar damages blood vessels and nerves, weakening the immune system and restricting blood flow to the wound site, making it difficult to heal. Don't wait until a small symptom becomes a big problem. If you've noticed any of these signs, don't dismiss them. Talk to your doctor, share this video with a loved one who needs to hear this, and subscribe to our channel for more life-saving health information. Your body is talking to you. It's time to start listening.